Welcome, gentlemen. I'm here with two extraordinary surgeons, Fernando Fleishman, a cardiothoracic surgeon within the Department of Surgery here at Keck Medicine of USC, and Dr. Sukgu Han, a vascular surgeon here in the Department of Surgery at Keck Medicine of USC, and both are co-directors of the Comprehensive Aortic Center here at Keck Medicine of USC. And maybe to get things started off, what kind of patients do you see in the aortic center?
We see patients of basically from the beginning of the aorta all the way down to where it branches off to your femoral arteries or in your groin. We basically together take care of every part and every aspect of the aorta.
Yeah, so to echo Fernando's description, basically any problem that has to do with the aorta, both aneurysm problem, which is an abnormal ballooning of the aorta, or occlusive problem where there's too much calcium in the plaque that causes blood flow problem. And then of course there's the aortic dissection that could actually cause both. And it's quite an emergency when those patients come in.
What makes the aortic center different? What stands out about our aortic center?
The administration at Keck has really given us the opportunity and the freedom to build a team that is specialized in aortic care, ranging from complex open operations, the ascending arch work that Dr. Fleischman and cardiac surgery team does, to thoracoabdominal, where we collaborate very closely as co-surgeons, all the way down to the iliac bifurcations and these things that are done using stenting, endovascular approach. And so we have expertise and the tools and access to technology that other centers in the region don't. And so we're definitely proud to say we're ahead of the curve on that.
So speaking of that, though, in terms of a cardiothoracic surgeon and you, Dr. Fleischman, and a vascular surgeon and you, Dr. Han, how unique is this partnership that, I've been around the block a few times and it's unique in my eyes, but tell us a little bit about that.
Yeah, for some reason, cardiac and vascular have not been the best friends in the past. Dr. Han and I are, and I think it is unique. It's very, very, very rare. There's very few other centers that have people two surgeons that trust each other the way we do. I mean, I don't know of any, and we've actually spoken in multiple conferences just on how to collaborate, and it just doesn't seem to work for others, but it works for us.
They all say they do. They all say they get along, but really I think proof is really in the productivity and the collaboration that happens and then the results that we're getting and our performance of the center in multiple trials, because as soon as we get involved, we're usually in the top 3 in enrollment of the trials and the handling and the outcomes as well. And so we have to credit our predecessors for setting this whole system up with Dr. Von Starnes, our chair, Dr. Fred Weaver, my chief, and also Dr. Robin Cohen, who was a co-director at the time when this whole thing started in 2012, right? So we've grown a lot since then, but I think that's really the culture that's been set, and it really doesn't hurt working with a good guy, that you trust. And fun person to be around,
One of our goals at Keck Medicine across the medical field is to provide minimally invasive surgeries and techniques because of the recovery and all that goes with that. What are you guys doing in the center to kind of further these minimally invasive kind of techniques?
We are part of pretty much every available trial of devices that can be used to treat the aorta. And it used to be that you couldn't go to the arch, you couldn't go to the ascending, you couldn't treat the valve in a minimally invasive way. These were like these are like fantasies from like the Jetsons in the future, right? Yeah. But we're now able, not for everybody, still investigational, we're pushing the innovation, we're pushing forward, but we are able to offer minimally invasive techniques for things that were traditionally a massive open surgery. We still obviously offer the open surgery, but that's given us a tremendous amount of growth. And Dr. Han has just been amazing in his fenestrated techniques. He's able to use his engineering mind to build devices that are patient specific. and yeah, it's really impressive to watch.
This is where partnership comes in really crucial, and tackling this particularly the arch and the ascending pathology using fenestrated stent grafts. It's still at its sort of infancy stage right now. Not a lot of even feasibility trials are going on for that. But together we're kind of gaining experience, and we see the progression in both technique advancement and how we build the devices in a way that facilitates safer implantation. And so those are sort of the projects that we've been working together very closely. So, that will go and it will continue to grow. And in some ways, it's showing the industry how to think about these problems for their device development.
Well, gentlemen, I'm in awe of both of you and what you do for patients. Just the patina you give Keck Medicine of USC, your heart and soul. This is a lifestyle running this aortic center, because it's all hours of the day, as we've talked about. But I am deeply in debt to you. I'm in awe of you, and I want to thank you guys for what you do for our patients and the lives you save every day. Really appreciate it.